Beth, and I'm going to be doing a head-to-toe assessment on John. John, have you agreed to be videotaped for this head-to-toe assessment?
I have.
Great. Okay, my name is Beth, and I'm going to be your nurse today. I'm going to go wash my hands, and I will be right back. Okay. Now, with this head-to-toe assessment, I will be starting at your head and working my way down. And at times I may be listening, sometimes I might be visualizing you, and I will explain everything before I go forward with this. Before John and I started today, his vitals were taken and they were found to be within normal limits, as well as mini mental status exam, and he is alert and oriented ×3. Okay, so the first thing I'm going to do, John, is I am going to feel your scalp and head. I'm checking for any lumps or bumps or anything out of the ordinary. He is balding, but it's nothing out of the ordinary. His hair is clean and not dry, so that's good. While my hands were on his head, I could feel his temperature. It was normal. His skin coloring, which appears to be, again, normal for somebody of his age and nationality. So, John, at this time, can I have you take off your glasses for me? Great, thank you. And I'm going to ask you to wrinkle your, actually you're kind of doing it now, wrinkle your forehead for me. Yeah, great. And I'm going to have you close your eyes and I'm going to try to open them. Don't let me. Okay, great. Can I have you pop out your cheeks? Good. And you can open your eyes, sorry. And you can smile at me, please. Good. I'm looking for symmetry, which is there. There's no facial palsy or any drooping, which is a plus. And I'm going to feel for your temporal pulses. And I'm going to move my hands downward to his jaw area. Could you grit your teeth for me? And move your jaw from side to side, up and down. Is there any problems, tenderness?
No.
Okay. And you have a regular dentist as well, do you know?
Correct.
Okay. And for the last thing I'm going to do on this area is I'm going to feel above your brow and under your eyes. Is there any pressure?
No.
No pain or anything, right?
Correct.
Okay, for your sinuses. Great. You can put your glasses back on. Actually, I'm sorry. I am going to examine your eyes first, and then I'll let you put your glasses back on. So at this time, what I would normally do is do a Snellen chart, which is the chart that stands 20 feet away. You stand 20 feet away from it. It has letters or numbers, and you call those out. Are you familiar with that chart?
I am.
Okay. We don't have one of those here, so we will not be doing one of those today, but do you see an eye doctor regularly?
I do.
Okay. And I see you wear glasses. How often do you get your eyes checked?
Every 2 years.
Okay, great. And there would be nothing preventing you from seeing the eye doctor. You're okay to go see them.
Correct.
Okay. So instead we're going to do something kinetic testing. And what I'm going to have you do is look directly at my nose, and you're going to close one eye or cover one eye, and I'm going to take my finger and put it behind you, and you're going to let me know the moment that you see from your peripheral vision when my finger comes. Great.
Okay.
Good. And the other eye?
Okay.
Good. Okay. Now what I'd like you to do with both your eyes open is follow my finger. Excellent. Okay, I'm going to just pull down your eyelids a little bit here, and everything looks clear. There's no cloudiness. There's no sediment. And okay, everything looks great. I have a little light here. I'm going to flash in your eyes. I'm going to take a look at your eyes. And I was checking for pearly here. And what PERLA stands for is pupils even, round, and accommodating to light, reactive to light. So that all looks good there. And what I'm going to do now is continuing on is I'm going to tug on your ears a little bit. Let me know if anything is sore or painful. Everything here seems symmetrical. Skin feels good, pliable. I'm going to have you cover one of your ears, and I'm going to go slightly behind you and whisper something. It's called the whisper test. And let me know when you hear it or what I say.
Book.
Great. And onto the other side.
Phone.
Excellent. Okay. I'm taking a look straight at you, and I'm looking at your nose. And if you're symmetrical, have you ever broken your nose or
No.
anything? Great. And I'm just going to look up your nose. Patency. Awesome. Okay. And you can put your glasses back on at this point. I'm going to have you open your mouth really wide for me. I'm going to take you keep your tongue in for a minute. There we go. Open. And I'm looking at the pink coloring. I'm looking at his gums, his tongue. Everything looks really normal. Can you say ah with your tongue in your mouth?
Great.
And at this time, I'm looking at his soft palate and his uvula, and everything looks really good. I'm going to have you be rude and stick your tongue out as far as you can. And then stick it to the right and to the left or your right. Good. Okay, and I'm not seeing any undulation or any problems with your tongue. Do you have any problems with your speech or anything like that?
No.
Good. Okay, so that finishes that part of the exam on the head area. What I'm going to do now is I'm going to feel around on your neck. And what I'm feeling for right now are your lymph nodes. Any tenderness in there?
No.
And I'm going to feel for your carotid arteries one at a time. Carotid pulse, I should say. Sorry. Good. And I'm going to feel for your trachea using 3 fingers coming down. It is exactly midline, so that's good. And can you swallow for me? Awesome. Okay. Now what I would like for you to do, first you're going to put your head forward and then back. Go ahead. Any pain?
No.
Side to side? Good. And ear to shoulder. And any pain or stiffness or soreness while doing
No.
that? Okay, can you put your head back a little bit for me? Don't let me push it forward. Okay, and go forward. Don't let me push it back. Go to the side. Don't let me turn it. And go to the other side. Don't let me turn it. Great, can you shrug your shoulders up high? Good, don't let me push them down. Excellent, okay. I'm going to go behind you. Okay, while I'm behind you, I'm just putting my hands on your neck, and I'm feeling for your thyroid. I'm also feeling for other lymph nodes, nodules. Can you give me a swallow, please? Awesome, thank you. Okay. While I'm back here, normally my patients would be in, for a male, just in his underwear, and I'd have a better glimpse of his back, but we're going to pretend. So I'm going to tell you that John has no marks or lesions or moles of dubious origin. I can see him breathing normally from the back. Everything is pretty symmetrical. I'm going to feel down his spinal process, and let me know if anything hurts or is painful. I'm not feeling any bulges or any problems here. Great. At this time, I'm going to percuss, and John, that just means I'm going to tap lightly but firmly at the same time. Let me know if you have any pain. I'm percussing C for CVA, which is kind of if somebody's having problems with their kidneys. Any pain there?
No.
Great. And one of the things I'm going to do now is I'm going to listen to your lungs. I'm probably gonna have you breathe in and out deeply every time I move my stethoscope, okay?
Okay.
Lung sounds posterior are clear in all fields. I'm gonna come back around. Okay. I've counted John's respirations, and they're about 18 per minute, which is well within normal limits. I'm taking a look again at his front. Everything seems pretty symmetrical. He is not using accessory muscles to breathe, and I'm going to listen to breathing on the front side as well. Take a deep breath. And again. Again. Go ahead. Deep breath. God bless you. God bless you. Okay. The front breathing sounds were normal in both fields, symmetric, and they sounded equal in nature. The one other sound I'm going to take a listen to is I'm going to place my stethoscope at the apex of your heart, and I'm going to have you lean forward and take a deep breath. One more time. And I was just listening for murmurs. Okay, that's great. So next thing I'm going to ask is, can I just see your hand for a second? Good. Okay. I'm looking at John's hands. They're soft, no calluses. They are clean. His skin coloring is good. They're dry and warm. I'm gonna kind of snap your skin here. He needs to have some more water at this time. And I'm checking for his fingernails. There is no clubbing and no cyanosis. So I'm just going to check for capillary refill. And I'm going to feel for, the capillary refill was fine. It was all with under 3 seconds. I see his pinky is a little different than the rest of his hand. Is this something that's in the past or recent? Childhood, okay. So it has a slight deformity, but does it give you much issues right now? Okay, good. And are you able to bend all your fingers? Okay. And good. Okay. Put that hand down. And I am going to get his radial and his brachial pulses, which match. At this time, I'm also going to feel for his lymph nodes. Okay. Put that arm down. I'm going to do the same thing to the other. Nice strong radial. finding his brachial pulse. Careful not to cut off the radial pulse. Okay, and they're both even. And I'm going to feel for nodules. And everything feels good right there. Okay, if you can follow my motion, one arm. Okay, any pain?
No.
Other arm? Okay, bringing this one up to you, just one at a time, going back, and like this, the other one, and go like that. Great. Okay, put your arms straight out for me, completely out. Don't let me push them down. Don't let me push them up. Okay, and then can you twist your wrist for me? Okay, and put your arms out again. Hands up, and flex down. Hands back up. Don't let me bring them to me. And don't let me push them back to you. Okay, you take my fingers and squeeze as hard as you can. Excellent. Okay, you can let go. All right, now at this time I'm going to have you lay down on the bed. Okay. So at this time I'm having John lay down on the bed. What I'm looking for here is differentiating between a carotid and a jugular, the jugular vein and the carotid artery pulse because if it was bounding or pulsating, this would not be a good position for him to lie in, and I would elevate the bed to at least 30 degrees. But I'm taking a look, it's fine, it's normal, so I'm going to go ahead and continue my assessment. So again, this is a really good opportunity to get a full-length look at John from head to toe, and I'm examining his chest. I don't see anything out of the ordinary. I don't see his chest pounding. So I'm going to let you know now, John, I'm going to take a listen. I'm actually going to feel for your apical pulse, which is right in here. Okay. And now I'm going to listen for it. I'm going to do this for 15 seconds. Now I'm going to listen to 5 heart sounds. I'm going to be listening to S1, S2. I'm going to be listening at Erb's point, tricuspid, and the mitral valve. S1 is located at the second intercostal space on the right side. S2 is the third on the right side. Then I move over to the tricuspid, which is also on the third but on the left. Then I go to the fourth intercostal, which is S1, S2, Erb's is third across, then the tricuspid is the number 4, and the 5th down is the mitral valve. I'm going to do this once, and then you'll see me twist my stethoscope, and I'll do it again listening with the bell, and it'll produce different sounds depending on how I'm listening with my stethoscope. So this will take a second or two. Excellent. No murmurs or anything found. Okay. I am going to look more towards assessing. At this point, I'd be looking at his umbilicus. I'm looking to see if there's any lines, any problems. I don't see anything. And I'm going to be listening to his vowel sounds first. When I'm listening to his vowel sounds, I'm going to be going in a counterclockwise motion, starting with the right lower quadrant, going to the right upper quadrant, moving over to the left upper quadrant, and then going to the left lower quadrant. When I'm done with that, you'll see me percuss, and I will do that in a zigzag motion. And then finally, I'm going to palpate I'm going to palpate it. I'm going to ask my camera woman to sit down. So I did that in a zigzag motion, and now I'm going to feel in a light touching motion. Anything hurt or bother you? Okay. You have regular bowel movements?
I do.
Okay. No tenderness in your belly or anything like that?
Correct.
Okay. So now that I've done that assessment, I can move on down. As I'm looking at John, I can check his hips and placement and feel where they are. Sorry about that. And move the bed while I'm doing it. Do you have any problems with your hips or walking?
No.
Okay, great. I can take a look at his legs. And at this time, John, I'm going to have you lift up your left leg first. Great. I'm going to keep that. And then move and come back down. And move the other leg up. Great. Okay. And come back down. Now, keeping this point kind of locked in its place, I want you to scissor out and come back in. So you're going to take your leg and come out this way, and then come back in. And then go the other with the other one. Okay. And come back in. Any problems doing that?
No.
Now, if John was not able to do this, this is called active range of motion. We would be doing it passively, where I would actually pick up his leg and move it out for him. Can you bend your knee for me? Okay, and come back down and do the other one. Great. Okay, come back down. Can you lift your leg, this one up for me? Don't let me push it down. Okay, and then don't let me push it up. Oops, come down here. Don't let me push it up. Okay, good. And down, and don't let me push. Okay, don't let me push it back up. Great. Okay. So now what I'm going to do is I'm going to feel for his popliteal pulses, which are underneath the knees. Good. Okay. And then I'm coming down and I'm taking a look at his legs and his ankles. At this time, we're going to pretend that he has his socks off, and I would be looking at his full feet and looking for edema. I don't see any in his legs or his feet. And I'm going to feel for his tibial pulses. And his pedal pulses. And they're nice and steady and even. Okay. John, can you rotate your ankle a little bit? Around. Okay, and the other one? Any pain?
No.
Okay. Can you wiggle your toes for me? And I'm going to check for capillary refill. We'll pretend to. Okay, and all his capillary refills were at least within 1 or 2 seconds, so way within normal limits. John, can you pull your foot back for me? Don't let me push down. Okay, and relax, and don't let me push up. Great. Other one. And push down. Okay. So taking a look at his legs, everything is looking good. Again, his skin looks really well. He doesn't appear to have one leg longer than the other. There's no edema. Pulses are good. So I'm going to have John sit up for me, please, on the edge of the bed. At this time, I'm going to have you, can you look at your knees? Can we have you like kick out just one? And then the other one? One at a time, sorry. Okay. And then I'm going to try to push down. Don't. And then, good. And don't let me push up. Okay. Don't let me push up. Now at this time, I would do a deep tendon reflex of the patella. That's where you have one of those little mallets, and I would give a nice gentle but firm tap right here and right here. I don't have one of those instruments so we are going to pretend to do it, and he'll give an involuntary kick like that and like that. Okay. So after he is finished with those kicks, we're going to be moving back upward here, and I have something soft here, and what I'm going to do is have you close your eyes, and I am going to touch you at certain places of your body, and you need to tell me where you feel that this is where you're being touched. Okay? All right.
Cheek, arm, hand, leg, foot.
Great. You can open your eyes. Awesome. Okay. Now what I'd like for you to do is put your left hand out for me. Palm up. Close your eyes. And close your palm. There's something in your palm. You can open your eyes, but not your hand. Can you feel what it is? Do you need to close your eyes to feel it so that you don't see it? You can do that.
It feels like a paperclip.
It is a paper clip. Good job. We're going to do the same thing with your other hand. Okay, close it.
Feels like a ball or a marble.
It is. Very good. It's a marble. Okay. Now, I'm going to have you, can I see your hand, please? I'm going to do this one first. Turn it over. What I'm going to do is your middle finger, I'm going to have you close your eyes, and I'm either going to move it up or down, and you're going to tell me which position the finger is in.
Up.
Okay. Can I see your other hand?
Up.
Great. Okay. Go ahead. Open your eyes. Now, this is going to be a rapid motion. What I'd like for you to do is go like this, and then again like that. Okay, and as fast as you can go. Like this.
Oh.
And then do it again. Okay, and that looks great. We're almost to the end. So one of the last things I'm going to have you do is I'm going to have you stand up, and I'm going to have you stay. Have you stand up and just walk there, and then stop and turn back towards me. I can see that John is walking straight. There's no hip, just stop right there. And hip movements that I need to be concerned about. And can you, on your way back here, John, can you walk with one heel to toe, like if you're walking a police lineup? A straight line. Great. Oop. There you go. Okay, come on over here, and then walk back a few steps on your heels. No, not forward. That's really good. Walk forward on your heels, I meant. But good. Okay, and a few steps on your tippy toes if you can. Okay. Now let's turn towards the camera for a second. Okay, feet both put together. Arms at your side, and look straight ahead for a minute. This is called the Roberg test, and we expect to see a little bit of swaying. We'll see a little bit more once he closes his eyes for a minute. Close your eyes, and that's why I'm standing here for safety. There's a slight sway, but he's not falling down, so that's good. You can open your eyes now. Okay, what I'd like for you to do is bend forward And bend back, not too much, don't hyperextend, okay? And then if you need to hold on to the bedpost, say, I need to see a deep or a knee bend on each one. Okay, I want to thank you for doing this for me today, and knowing you're my husband, I will give you a kiss, but I wouldn't do that for my patient. So thank you. There you go. You can stop it now.